Well, this morning we're talking about women's health for the morning medical interview. So I asked my good friend Kim Ratcliffe to help out with this one, since she probably knows a lot more about female pelvic issues than I do. Kim, job well done.
You were right. Thanks, Bob. We've got Dr. Timothy Chase here. He is a urogynecologist and also the first in southeastern North Carolina to be certified in pelvic medicine and also reconstructive surgery. So thank you very much for joining us.
Thank you for having me.
I appreciate it. Two of the main topics I think that we were going to talk about, because this really deals with women, things like incontinence and something called pelvic organ prolapse. I know incontinence, a lot of people know exactly what that is. A lot of women have to deal with it. So talk first about some of the things that cause that incontinence. I know there might be a lot of myths out there as well.
Well, I think a number of things cause it. I think the normal aging process causes it, the lack of estrogen as a woman grows older, and also childbirth.
I had always heard the childbirth part of that, but are there other forms of continence? I guess, are there degrees of severity?
Yeah, well, there's two different types of incontinence. There's stress incontinence. That's where you leak when you cough, laugh, sneeze, or exercise. And then there's urge incontinence. That's the type of incontinence you get if you get the urge to go and you can't get there in time.
Okay, and what are the treatments for those? Are they the same or different?
Well, it's mainly with urge incontinence, it's mainly medicines. With stress incontinence, it's an outpatient surgery.
And that's one of your specialties, right, as far as this surgery goes, and it's a lot easier than let's say, it used to be? Yeah,
the surgery nowadays is usually a bladder sling, and it's outpatient surgery, so you come in, have it done, go home the same day. It usually takes 15-20 minutes, and usually patients get immediate results.
Oh, wow. And any side effects or any sort of downsides to that one?
Usually patients are able to go back to their normal activities the next day or the day after that. For the first couple weeks, I want them not to lift heavy things as they're healing.
Sure. All right. And also we wanted to go over this pelvic organ prolapse, which honestly I didn't know what that was, but I'm going to try to break it down. It's basically the muscles in the pelvic area and them being weak or maybe damaged, and therefore the organs are now pressing against the vagina. So there's a lot going on there.
Right, and actually it's a lot more common than you think.
Okay. 30%
of women will have some form of pelvic organ prolapse during their lifetime.
Oh, wow.
And that encompasses mostly cystocele or rectocele or uterine prolapse.
And are these mostly older women, or?
No, I'll see patients even in their 30s that are having problems with this.
And what are the symptoms for that? Like, will you know that that's going on?
Yeah, the main symptoms are just kind of a heaviness or feeling a bulge sensation in the pelvis. Those are the main symptoms. Sometimes trouble with emptying the bladder.
Okay, and treatments for that? The
treatments, there's some treatments we do in the office where there's certain devices similar to a diaphragm that can help. Or there's really good advances in the surgery for pelvic organ prolapse, too.
All right, Dr. Chase, we are out of time. A lot to go over, but hopefully we got a lot of interesting information out to you this morning. Thank you for joining us. And let's head over